Good evening, everyone. It's 6 o'clock. I'm going to call the meeting of the Community Mental Health Board to order, and I'll begin by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Motion to adopt the agenda is in order. And
Support.
motion by Flynn, supported by O'Connell. All in favor signify by saying aye.
Aye.
Opposed? Next is item number 4, approval of the minutes of our regular board meeting that was held on November 20 of 2018. Oh, yeah. I am very sorry. Number 3, hearing of the public. Is there anyone from the public that would like to address this board? You could give us your name and address, and you have 5 minutes.
Sure. My name is Tyler Robke. I live at 55278 Wolverine Drive in Macomb Township. I'm also the compliance officer and in-house counsel at MORC 16200 19 Mile Road in Clinton Township. Last time I was here was in September, and I talked to this board about our contract with CMH that we were discussing at that time, and I'm happy to say that we have worked that out. We've come to an agreement on that, and I believe that that contract is on this board's agenda tonight for approval. I'm here tonight to talk about a different issue. We signed a fee-for-service agreement with CMH in 2 years ago at 2015 rates. And over the course of that contract, we have collectively agreed to and absorbed more than $5 million in cuts, resulting in an over $5 million savings to CMH. During that time, we also provided county and state mandated training to direct care providers. We trained over 5,000 direct care providers, and we did so at no cost to the county. That's something we take a lot of pride in. We know that the quality of the training that we provide benefits the individuals served and provides them with caring, well-trained, safe staff. Effective January 1st, 2019, we're scheduled to take an additional 10% rate cut. And at that point, it places us as a company in a financial situation where we can no longer afford to absorb the full cost of providing that training to direct care workers. We first raised that issue in October in our meetings with staff at CMH. For various reasons, staff either wasn't prepared to discuss it at those meetings or the correct staff wasn't able to be there. So we haven't had any further discussion on that topic. We've provided a cost analysis of past expenses to CMH, and I believe that we've provided a proposed cost lower than that historical cost in light of the financial situation. Again, we haven't had a discussion on that or come to a resolution. We were hopeful that that might happen this week, but it did not. As a result, tomorrow we'll be sending a notice to all of our providers that will inform them that we'll no longer be able to provide training to direct care staff at no cost. We're still looking at options of whether or not we'll still be able to provide training, exploring funding options for that, whether or not that means charging the providers for that or some other mechanism. However, we're afraid that this will have a domino effect on the provider community. If they're unable to get this training for free through MORC, they may not be able to afford it financially within their own budgets. Also, there may not be the capacity within the system of training that CMH provides in order to adequately train all of the new staff coming in, and perhaps that could further exacerbate the direct care staff crisis that we're currently experiencing. I don't say this with any pleasure. This is not how we like to do business. Believe me, respectfully, I don't enjoy coming up here and talking to the board about these things, but I wanted to bring this issue to the attention of the board because I think it's a very important issue that deserves some discussion, and perhaps we could bring that to the forefront of the discussions as we go forward, because we need to figure this problem out. We have a long history of working with the staff at CMH and working with this board in order to resolve issues. We saw that with the contract earlier this year. We saw that last year with the savings that we were able to achieve, again, over $5 million. We can't find solutions together if we don't talk about it. So, again, I'm just hoping to bring this issue into the light and into discussions, and I hope that this board can maybe motivate or direct some conversations to occur, and hopefully we can come to a solution on this. Thank you.
Thank you, Tyler. Is there anyone else from the public that would like to address this board? Anyone else? Seeing none, we'll close this portion, and just to make a comment that while we don't reply to public comments that are made, somebody will get with you. Thank you for bringing that to our attention. Next is item number 4, the minutes, approval of the minutes of the board meeting held on November 20 of 2018. Motion by Flynn. Support by Schmidt. Any discussion on the minutes? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is approval of standing committee meeting minutes and recommendations from, there's 3 of them. Minutes of the Personnel Committee meeting held on December 3, Recipient Rights Advisory Committee held on December 6, and the Program and Budget Committee held on December 13. Motion by Bush to approve all 3. Support by Phillips. Any discussion on any of those 3 meetings, minutes? All in favor signify. It's in, yes, it's in the packet. Okay. Any other questions or concerns? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is a request, item number 6, request to approve. There's 3 items that were discussed at our program and budget meeting and were approved there and forwarded to this request.
Separate B, please.
Yes, we'll do that. So right now, we have item A, request to approve and modify the language in the specialty services contract and out-of-state travel for corporate compliance officer.
Move to approve A and C.
Motion by Kraft to approve, support by Schmidt. Any questions or discussion on those 2 items? All in favor signify by saying aye.
Aye.
Opposed? And then we're on item 6B, approval of residential lease A. Motion by Bush, support by Flynn. Discussion. Lou, you wanted your vote carried forward?
I do.
Is that the sole purpose for, or did you want to bring up something else?
No, just bring the vote forward.
All right, very good. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item number 7, to receive and file 4 documents. We have, these were all approved and sent forward from the program and budget. Motion by Flynn, support by Kraft. Any questions or discussion on those 4 items? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item 8A, which is a resolution presented to John Kinch upon his retirement. A motion to approve is in order.
Move to approve.
Motion by Bush, supported by Schmidt. All in favor?
Aye.
Yes.
I think we should let him retire.
I was good point. Well taken. And actually, it's good that it was approved because it was presented yesterday at the open house. But if it wasn't, we could ask him to bring it back, so. And then we have items B, C, D, E, and F for additional staff retirement. Do you want to take them together or?
Take them together.
All right, that's a motion by Birdie to approve B through F. Supported by O'Connell. Any comments or discussion on those? It's Lynette Buckler, Rebecca Tron, Suzanne Desolate, Mary Taduziak, and Deborah Willard. Any other discussion? All in favor signify by saying aye. Opposed? So you are in the company of others. As you go out. Next is item number 9, the voucher list of bills to be paid. Motion by Birdie to pay, motion support by O'Connell. Any questions? All in favor signify by saying aye. Opposed? All right. And next is the management report. And anything you would like to?
Yeah,
report?
just briefly, and I'm going to turn my management report over to Dave. Dave wants to report out to the board. I would hope that the board continues to support administration as you have over the years, and continue to do that. You know, there's a lot of challenging times out here, and I want you to trust in your administration. Some of the things that are presented before this board are preposterous and laughable. I think you heard a little bit of that earlier tonight. And you need to trust in your administrative staff. And I hope you do so. I trust in them and I respect them immensely. Wish you all well and wish you all good luck. And it's been a pleasure working with everybody. Thank you.
Thank you. And before we leave you, one more item of attention. Commissioner Kraft has a resolution from the Board of Commissioners that he would like to present.
I'm stealing Dave's thunder. I saw him turn the mic on, but I'm going to jump in before that. John, at our most recent full board meeting, the Board of Commissioners wanted to present a proclamation to you for your retirement. And reading over the proclamation, I realized that you were hired by CMH 1 month before I was born. So I'm excited. I'm excited to present this to you, and I know you're excited to be heading out of here. So, John, thank you for your years of dedicated service. The board thanks you and wishes you well, and we hope you enjoy your retirement.
Thank you very much. I will.
No, I'm not going to read it. It's a mile long.
All right. Thank you, Commissioner Kraft. And now to our new director, Dave Pankatai. Do you have anything you'd like to share?
Just very briefly, Phil, that's a tough act to follow, and John, thank you very much. This is day 3, and John has been very open and is sharing a ton of information. I am trying to absorb as much of that as possible. All of the staff, and as well as the board members here, have been very supportive. They're making this transition a lot easier. Couple housekeeping items. The schedule that you have for on the calendar did not include dates in January. I do have some of those for you to add to your calendar. Wednesday, January the 9th, it's at 6 p.m. is the Program and Budget Committee meeting. Thursday, January 17th at 6 p.m. is the Metro Region Dinner Meeting. Oakland County is set to host that. We do not yet have the location. And Wednesday, January the 23rd at 6 p.m. would be the next board meeting. Also, if you could pencil in February the 6th, the Metro Region is looking to hold a legislative breakfast. It's currently in the planning stages, and that will be in Lansing. It's on the last day of the winter conference from the association, and more information will follow. Oh, I'm sorry, Kalamazoo. Sorry.
So they're looking to hold it in the same location, or we don't know yet?
We don't know. I missed the first planning meeting was before my hire date, so.
All right, we'll get more information on that then.
Right.
Anything else?
The motion?
Yeah, we'll get that.
No,
next.
thank you.
So which leads us then to item number 11, which is other agenda items. And the first item there is to approve the dates, board meeting dates, which we have on this goldenrod paper in front of us. And then it includes the, actually goes into January of 2020, just for book, or housekeeping purposes. It's good to put that date out there. But then we also have January 9 for program and budget, and January 23 for the full board.
That's for next year.
No, for this, yes, for 2019. Next month, right. So we need a motion to approve that.
Move to approve.
All right, move to approve the calendar by Bush, support by Kraft. Any questions or comments on the calendar? Lou?
Just a comment about February 6th, if there's going to be a legislative breakfast on the last morning of the winter conference, somebody had better clear the calendar, because generally speaking, that's something that the state association plans for, that breakfast, and usually includes state speakers. That might be hitting a brick wall at 50 miles an hour. Somebody had better make that coordination, or there's going to be an embarrassment, so.
Right. Right. Anyone else on the calendar? Phil?
Just to expand upon what Lou is saying, if the plan is to have state representatives and state senators there as well, it's a Wednesday. They're usually in session Tuesday through Thursday, and their calendar basically from January to June is stacked with session every week. So if there is a thought of getting state reps and senators there, I would recommend changing that date and take that back to them. Thank you, Madam Chair.
Okay, thank you. Yeah, and this isn't something we're planning, but we'll bring that information to the planning committee.
But actually,
Lou?
what Phil said, we used to hold a legislative breakfast in Lansing at the winter conference when it was there, and we gave up on it because the attendance of actual legislators became so poor. They were sending the third secretary down the line to show up and say, I represent Representative so-and-so, and it wasn't as prudent as it was intended. So there ought to be some work done on this before it gets too far, because traveling from Lansing to Kalamazoo to attend this breakfast doesn't seem likely. And it will obviously be in conflict with the state association calendar. So,
Right.
good point, Phil, thanks.
All right, thank you. Dave's assured me he will tomorrow deal with that issue, so. All right, all in favor of approving the calendar? Opposed? All right, the calendar has been approved. Then we also need a motion to approve attendance at the winter conference, which is, pre-conference is February 4, and the conference dates itself are February 5 and 6. Motion by Flynn to approve
The
Attendance.
commissioners and
and
staff.
s- appropriate commissioners and staff to attend. Support by Bush. Any questions or comments on that? All in favor signify by saying aye.
Aye.
Opposed? All right, that motion carries. Next, are there any other commissioners that have any other agenda items?
I do, Madam Chair. This is a time of the year where we recognize our staff. And they do so much work for us. And they're so good to us and wait for all our expense reports. So let's give Barbara and Lynn a big hand. Plus, I have presents. I bet you think we're gonna get a present.
No, we knew you were on the job, Joan. You always do a good job.
Now, that's Lynn. And that's from all the commissioners, except Nick and.
See what happens when you don't pay up? I think I gave her money today.
You just got called out, but you didn't even know it. Nick and that other guy. Thank you so much. Good job. And the other guy. We have a good time.
I think we should give John something else. I think we should give him his name tag. Is that okay?
I think he's the only one around with that name, so yes, we'll have to,
I can take it off.
we'll present him with that at the conclusion, after our meeting. How's that?
Okay.
I should have said what I
still got
need
my
to,
badge on.
to share with the group. I should have said it before we had the Christmas presents, because it's kind of like, it's not Christmas anymore, but Commissioner Kraft and I met this morning along with John and Dave, and county administration had a meeting talking about the budget and the continuing issues with deficits and pending deficits, whatever. And the only thing I want to share now is that it was just very clear the county does not want to take on having to supplement any of our finances beyond the statutory obligation that, the few million that, $3-4 million that they provide every year per state statute. So we need to continue working on that. I mean, the work's already been started. We've got a plan that was presented today to the executive's office and to the finance office, but we need to continue working on that. So just wanted to let you know about that. Anyone else? All right, hearing none, then we're on to item 11, item number 12, hearing of the public. Are there any additional comments or from the public? Anyone from the public? Seeing and hearing none, we will move on to item 13, adjournment. Motion to adjourn is in order. Motion by Kraft, support by Schmidt. All in favor signify by saying aye. Opposed? This meeting is adjourned. Thank you, everyone.